Okay, so I'm going to turn it around so that we can see the inferior vena cava here. So if we look at here, if we have this is our inferior vena cava, we know that this is now our right side. Okay, and this would be our left side. Do you want me to wait? No?
And that branches off even further.
So these are our pulmonary veins. We have two sets, and they both go into the left atrium. So here's the first two that go into the left atrium. Here are the other two that go into the left atrium. Okay, coming back from the lungs.
Okay. We were right.
Okay, and this is our trachea, just so that you know, but he's not going to ask you that. Okay, so now we have to do our blood vessels. So starting again, here's our right, here's our left. This little teeny branch right here is the left coronary artery. As soon as it branches, it turns into the circumflex artery.
That's right.
And then when it goes down here, it's the anterior interventricular artery. Okay? Then over here is our right coronary artery, which goes all the way around. And this little branch, disregard this branch, but this little branch is our marginal, right marginal artery on this one. Okay, so I'm going to stay with arteries, so I'm going to turn it around here.
So this is the...
Back here is our posterior interventricular artery here.
Okay.
And that's it for the arteries. Okay, so if we go back and we start with veins, this is called our great cardiac vein. Great cardiac vein, so it's both of these. It comes straight up and around, all the way over, and it dumps into this big structure, our coronary sinus. Okay? And I don't think we have any veins. The middle veins in the back. And this is our middle cardiac vein here. And it also dumps into the coronary sinus. So these ones you're going to just ignore over here and over here. It's just these two that are important in the back. Okay. You have the sulcuses. So we have the atrial ventricular sulcus, because atrium ventricle, so atrial ventricular sulcus. Atrial ventricular sulcus. And then the interventricular sulcus here and here. Okay, and that's where the vein and the artery runs through. Okay, so now we're going to open it up. Now again, in talking to Dr. Wagner about that, he said that he's probably going to only have one half. So say he has this half right here and this half doesn't exist. You're going to have to figure out what is right and what is left so that you don't get it screwed up. So the easiest thing to do is the left is always, the wall is always thicker than the right wall. So this is the left ventricle, this is the right ventricle.